It's a killer beautiful day here in Oregon. If any of you all have never visited Oregon, here's your excuse. Come to Oregon, knock on one of our Modern Nose Clinic doors, and say hi to me. That'd give me great satisfaction. Today, we're going to talk about something a little different. But first, I just want to say that I enjoy talking to you all, and I kind of picture myself, what are you guys doing while you're watching this? Are you like at home, look at your cell phone as you're going to sleep at night? Are you at work? Are you sharing this on Facebook? I don't know. But what I do know is this, is that it takes a lot of time, and we have a goal. We want 2,000 subscribers. So we've got like 130 right now. And I have no doubt that if any of y'all think it's useful to have this content, you can share it with friends, you can subscribe, so on and so forth. It just takes so many hours to do this. And I've got these 3 little kids at home, so I want to make sure I'm doing this for a big enough audience to justify the time. The more people who are watching these things, the more time it justifies. So, shameless plug. There, got that out of the way. So what is the topic today, Dr. Skarada? I look for inspiration each week, and I had 2 different people I was trying to pick from. I'm going with olfactory retraining. We see patients on a regular basis who can't smell. Either that or they smell something that is unpleasant. And I just thought we'd talk a little bit about that today. So our goal, make you smarter, another nugget of knowledge. Okay, so the topic, dysnosmia, and I'll show you how it's spelled. It means that you don't smell something correctly. Maybe you're smelling cigarette smell or something burning, and you ask your friends and family members, which is the first thing to find out. Maybe, is there something that you smell also? Because if they're smelling it also, you just may have an exceptional sense of smell. So let's forget about those people. All right, so you ask your friends and family, no, I don't smell anything, but you're smelling something and it's probably not pretty. I don't get many people showing up saying, wow, I have this lovely smell all the time. It's always something not nice. Or they just lost their sense of smell altogether. And then you say, aha, I did not subscribe to Dr. Skarada's Modern Nose Clinic YouTube channel, so I'm trying to do it old school. I'm going to Google it. Look what happens. Kind of cool. You clearly type in dysnosmia, spelled D-Y-S-N-O-S-M-I-A. But the Google search says, I'm smarter than you. I'm going to show you results for dysnomia, which is completely different and not helpful at all. And then you persevere and you type in again, D-Y-S-N-O-M-I-A. And this time it comes up with dysosmia, which is not the way I refer to it, but perhaps ENTs out there will say that they sometimes call it this. I don't know. But interestingly enough, health conditions related to this search, allergic sinusitis and sinusitis. And at the Modern Nose Clinic, we treat allergy, sinuses, and snoring. This is why we see people with this problem. The clinical appointments are always so hard because we only have like 30 minutes, or sometimes we'll do 40 minutes. And you can only talk about so much. And if you talk about too much, it's information overload. So these videos often will complement. And when we see anyone with olfactory problems, you can't smell or taste well, we'll refer them to this video. So it does help us out. But even here, who's my audience? Other ear, nose, and throat doctors, primary care doctors, my peeps, the family, the Modern Nose Clinic family. I could go on for an hour with this. So please forgive me if we gloss over the top of it all, but there's a lot of topics I want to hit, so it's going to come at you pretty fast. Here we go. When you guys say, hey, it takes you hours to put these things on and they're all polished when they're done, I just thought I'd show you. Here's my mind dump. I just sat down and I dumped onto a piece of paper some thoughts as I try to put this together. Don't worry, I will organize this for you. Okay, so mechanical. You need to get tiny little olfactory particles, which are the pieces of the thing you're smelling, to float into your nose and get to the top of your nose. And all of these things could prevent that from occurring. This is just a subset of everything we look for, but nasal polyps, will prevent those olfactory particles from getting up there. Large turbinates, which are kind of like branches that dangle into your nasal airway, and we all have them, and they could be large, and that could be the problem. We really spent a lot of time talking about turbinates at the Modern Nose Clinic. The nasal septum, we've all heard of deviated septums, and if you watch our video on the nasal septum, you'll know that most people do have a deviated septum. Not an issue unless it's causing problems. And then inflammatory problems, like you have allergies causing inflammation of your nose. You have a virus or a bacterial infection causing mucosal inflammation. The lining of your nose gets swollen, preventing particles from getting to where they need to get to. So we want particles to enter your nose and go up. We call this physiologic airflow at the Modern Nose Clinic. And up here is where your olfactory nerve comes through. There's the olfactory bulb, and this is the nerve coming through all these little tiny holes. It's quite beautiful and elegant. And it comes down, draping across the mucosa throughout your nose. So whenever we do a procedure at the Modern Nose Clinic, one of our goals is to enhance nasal airflow by directing air more up across that space. Number 2, you were involved in an accident and you hit your head. Well, heck, even if you kind of hit a soccer ball with your head, you're hitting the soccer ball, it can cause this problem. The brain will shift back and forth as it rests, like resting on a waterbed. It's designed to move around so as to minimize trauma when your head is hit. If it moves just the wrong way, it will shear those tiny little olfactory nerves as they go through those tiny little openings in your skull, and that will lead to permanent loss of your sense of smell. So it's a shearing mechanism. So basically your head gets hit and the brain will shift back and forth, or even this way, and these little nerves that come through here will be torn. Matter of fact, even with sinus surgery, which you know at the Modern Nose Clinic, we don't believe in sinus surgery. We think that it's a terrible way to go, but it can be so brutal that it too can shear those nerves. So if you've had a sinus surgery, you may have a similar mechanism of injury for your loss of your sense of smell. Next cause is a chemical injury. And we live in the wine country, farm country, lots of farmers here. Love y'all. Also, people exposed to various solvents and pesticides and so on and so forth. This can also damage and sometimes permanently damage your olfactory nerves. Be careful. It could be a side effect to a medication. This is great when that's the case, because sometimes by stopping the medication, your sense of smell will return. Also, at the Modern Nose Clinic, we don't like surgery. We also don't like antibiotics. We feel they're being used far too often. So how ironic. You think you lose your sense of smell, you're given an antibiotic, and maybe that's what caused it. Antidepressants, anti-inflammatory. Again, inflammation can cause a decreased sense of smell because you can't get the olfactory particles up to your olfactory nerve, but anti-inflammatories can also cause this. And heart medications. Why not check with your pharmacy? Ask them to go through all the medicines you take and see if any of them have a side effect that could impact your sense of smell. Cocaine use. Nothing more needs to be said on this one. Aging. Your sense of smell is most acute between the age of 30 to 60. Over the age of 60, you slowly have a decline. Everyone does, like their sense of vision and hearing, etc. Anyway, as you get older, it is normal to have a decrease in your sense of smell and probably also your sense of taste. As I said earlier, we could go on for an hour, but briefly put, this could be evidence of a more serious medical problem, such as Alzheimer's disease, Parkinson's disease, multiple sclerosis, a severe nutritional disorder, hormonal imbalances, or this could be a congenital problem. I lack the L because I could not type it in. Sorry. So what are we going to do, Dr. Skarada? What do you say about that? Like his balloon? Damn, he's good looking. Anyway, we have something pretty novel here, again, as if you're surprised with that. Our recommendation, well, first of all, you need to find out why you have this problem, and obviously, depending on the diagnosis, it will really change the recommendations. But assuming maybe it was a viral problem or it was mysterious, you did your workup, we could not come up with an explanation, we like something that we call olfactory retraining. Olfactory retraining means you want to get a couple of pleasant smelling things like lemon zest or, some lemon smelling item, orange, cinnamon, mint, maybe coffee, whatever it is you think is pleasant smelling, and put it in some vial or some kind of container, and maybe have it by the TV perhaps, or anywhere you want to be, maybe in the car. And as you are watching an advertisement, pull out the lemon zest and smell it, and close your eyes and picture the biggest, juiciest, luscious lemon that you plucked off the tree, and you ripped it open, and you just took a giant bite of it, and you're smelling that smell while you're tasting this in your mind, and you're trying to retrain your brain. Do the same for all the others and work at it. Just like the person who lost their ability to walk, they have to force the part of the brain that did not help you to walk to start taking over that responsibility. Now look, if you sheared your olfactory nerves because of a surgery, and we don't like surgeries, or because of a car accident or head trauma, those nerves do not come back. I mean, you can remain positive and hopeful, but I would be a little more skeptical, and I would want to be more realistic for those patients. But for those people who lost it because of a viral illness, which is really common, I say go for it, and go for it early, because it can make a bigger difference. You just survived another episode of Nuggets of Knowledge. Congratulations. Subscribe. We need 2,000 people. Like. Very much appreciate it. See you next week.